I'm Jonathan Kay of the University of Massachusetts Medical School in Worcester, Massachusetts. I'm here at the ACR 2019 meeting in Atlanta, and I saw a poster that Renee Westhoven's presented, number 548, about the subcutaneous formulation of the biosimilar infliximab CTP-13. CTP-13 is a biosimilar infliximab developed by Celltrion in South Korea that has been approved in the European Union, the United States, and many other countries. In the United States, it is marketed under the brand name Inflectra. In Europe, it's marketed under the brand names Inflectra and Remsima. And this biosimilar infliximab was reviewed and approved according to the abbreviated biological license application in the United States as an intravenous formulation in comparison to bio-originator infliximab Remicade. The intravenous formulation was approved by the FDA as a biosimilar and has been used by patients around the world with no significant loss of efficacy as shown in the Northwich study and no increase in safety risk. Celltrion developed this biosimilar infliximab in a new formulation as a subcutaneous administration of 120 milligrams subcutaneously every other week. They conducted a non-inferiority study comparing the intravenous formulation to the subcutaneous formulation after 2 loading doses of infliximab 3 milligrams per kilogram intravenously. 362 patients were enrolled and were randomized 1-to-1 to receive either the intravenous or the subcutaneous formulation. The results of this study were presented up to 1 year by Renee Westhoven's, who showed that there was non-inferiority of the subcutaneous formulation compared to the intravenous formulation, with no safety risks identified that were novel. The steady state trough level of drug was better maintained with the subcutaneous dosing than with the intravenous dosing every 8 weeks, where there were peaks and troughs that would be expected given intravenous dosing. The question comes up when this drug is evaluated by the United States Food and Drug Administration: is this a biosimilar? Well, to be a biosimilar, medication has to be administered at the same dosing regimen and route of administration as its reference product, and certainly infliximab reference product is administered only intravenously. Thus, it is likely that the United States Food and Drug Administration will require this subcutaneous formulation to be evaluated as a new biopharmaceutical according to the 351A pathway rather than the 351K pathway for a biosimilar. However, the FDA has not yet evaluated this medication fully, and we have yet to see how this regulatory process will proceed in the United States. Regardless, this is a very interesting first time where we see a biosimilar that is administered in a traditional route of administration being developed for a different route of administration. For more information, go to Room Now. I'm Jonathan Kay.